perhaps if I could use something that's also been in the news fairly recently is something like the rotavirus and the vaccine. And if your infant, again, we were talking about dating ourselves. So as a young doctor trainee, uh, our hospital during the winter was full of infants who had severe rotavirus disease, dehydration from severe diarrhea. And even if they didn't die, they were in the hospital sometimes for many days. And unfortunately, I was involved in cases where a few infants did die because of
Mm.
severe rotavirus. That was the wild type natural virus. The one in the vaccine is strategically weakened, so it doesn't cause disease. It only stimulates your immune system. And so, again, thinking about the precision and thought that goes into vaccine after extensive testing, both in a laboratory, in animals, and then ultimately in a small number of people, and then in many people, to again show that we are achieving the benefit that we want while maintaining the exceptionally high safety standard that we put in place for every one of our vaccines. And so I would just sort of again remind all of our listeners that the process by which a vaccine gets approved is really extensive and has to pass through all of those steps successfully. And anyone, if it fails in any of the early steps, the product ends there and it never sees the market and never gets to the schedule.